Our question today is from Stacy, and Stacy is a hygienist. So thank you, Stacy, for reaching out to me in this dental office manager's newsletter. Stacy is a hygienist. She also didn't say where she was from, but Stacy's question is, I am the person in the office who calls on overdue patients. What do I do with really old patients? I guess your question is not age old, but specifically for patients that haven't been in a long time. And that's a great question, because when you call and you send emails and you send postcards to these patients, at some point you get to a point of realization that these patients may not be coming back in. It may be 12 months, it may be 18 months, it may be 24 months past their due date, and you're like, what do I do with these patients? Well, I really believe that you need to come up with a reactivation program for these patients that have not been in your practice since my rule of thumb is 18 months after their due date. So they're obviously ignoring your phone calls, they're ignoring the emails, they're ignoring the postcards. So you really need to get creative. And there's a couple different things that I'm going to throw out to you where you can get creative with your reactivation program. I have a really good friend, Adele Reishi, who her suggestion is she actually creates video for offices and puts YouTube videos into the emails, which are fun and creative, and it's a really good way of reactivating patients that maybe have been ignoring some of the conventional ways of calling patients. Another thing that you can do, which is what I do with some of my offices, is make a letter. Sometimes if you send something in an envelope that is more personalized, maybe the letter says something about, we're really concerned about you, it's been a while since we've seen you, maybe your contact info is outdated, but we really want to hear from you. And it's a way of the patient getting something in the mail that's a little bit unconventional. I understand that a letter can be a little bit more expensive, but sometimes that's how you get their attention. So what I would do is, for your patients, your old patients, they haven't been in 18 to 24 months, is either create some kind of fun video, get a hold of Adele and see if you could work with her practice, with her system, or come up with a letter. I have a reactivation letter that I've used before, so you could email me directly if you want a copy of my letter, and see if either of those two things help you reactivate some of these old patients. Now, if they still don't reach out to you, I do believe that you might want to consider inactivating these patients. Not that you throw their chart away or you completely get rid of all their patient information, but inactivate them out of your active patient base, because you really need to keep an active patient count for other things. For example, knowing what your active patient base is really important for knowing how much hygiene hours you need and things like that. So do consider inactivating patients that ignore your last and final ditch effort to bring them into the office. So I hope some of those ideas help you, Stacy, and good luck in your reactivation process.